I'm Kelly Warner. This week, healthcare providers across Oregon are participating in HPV Vaccination Week, raising awareness about human papillomavirus and encouraging more people to get vaccinated. The virus is linked to 6 types of cancer and other diseases. And while oncologists are learning more about how HPV causes cancer, they say the best thing you can do is try to prevent it from ever happening in the first place. At Willamette Valley Cancer Institute in Eugene, Dr. Audrey Garrett treats patients with a variety of gynecologic cancers, and many of those cancers have one thing in common.
50 to 75% of my day-to-day office practice is HPV related.
Human papillomavirus, or HPV, is the most common sexually transmitted infection in the United States. It is the cause of most cases of cervical cancer, as well as 5 other types of cancer. HPV often has no symptoms, but it can be prevented. The American Academy of Pediatrics recommends that children get 2 doses of HPV vaccine before their 15th birthday, ideally between ages 11 and 12. For kids who are not vaccinated until after they turn 15, 3 doses are needed.
You want to get that vaccine in when their immune system is going to respond to it. We know that immune systems respond to vaccines better the younger we administer the vaccines, and we want them to have that before they've had any chance of coming in contact with that virus.
Dr. Garrett serves as an educational speaker for Merck, which manufactures the only HPV vaccine currently on the market in the U.S. Since the vaccine became available a decade ago, HPV infection rates have dropped dramatically. However, vaccination rates for HPV still lag far below vaccination rates for diseases like meningitis and tetanus. And Dr. Garrett says that's troublesome.
This is an incredibly safe vaccine, and for me, it pains me every time I have to see a 26-year-old, a 29-year-old, a 32-year-old, and I need to do something that renders them unable to have children because of an HPV-related disease, which they could have been given that vaccine.
Last fall, the FDA expanded its approval of the HPV vaccine for females and males up to age 45, but it is more effective when given sooner rather than later. To learn more about HPV and HPV-related cancers, head to OregonCancer.com/HPV. I'm Kelly Warner.